Dr. Bill Adams here, and this is everybody's favorite show, No Spin Live. We've got a great show for you today. We're going to be covering being operated on when you are awake, and how do you know your surgeon is an expert? And last, lasers. They're hot, and this is what you need to know about them. We've got a great group of superb plastic surgeons to help us with these today. We're starting with Dr. Brooks Seckel from Boston, Massachusetts. And we got Dr. Chet Mays from Louisville, Kentucky, getting ready for the Kentucky Derby, right?
That's right, 2 weeks away.
Last but not least, Dr. Jason Posner from Boca Raton, Florida. Well, listen, guys, let's get started. This first article came out. It's called Being Operated On When You're Awake. It's talking about people waking up from general anesthesia, but then it had multiple other things that are kind of bizarre medical things and surgical things. So I'm going to start with you, JP. What was your take on this article?
You know what? I think there's a lot of misconceptions to the public about doing things awake because, as Bill and I have discussed and on this forum many times, I think there's a real trend in our specialty towards doing a lot of procedures where we used to do them under general anesthesia. Now I'm doing a lot of cases that I used to do under general while the patient's awake. But I think as plastic surgeons, we all feel that the bigger cases, like breast augmentation and revisions, I think should be done under general anesthesia. I don't think you can get really good muscle manipulation and the work that I just can't do it under local. But I think many other specialties don't have the same credentialing and access to anesthesia that we do, so they're not able to offer the full gamut of procedures under the proper, we call them proper techniques.
What do you think, Brooke?
Yeah, I primarily use general anesthesia for most of what I do. Patients always ask, do I have to go to sleep? And, I try to encourage them, especially with a facelift, something like that. If you try to do that under local standby, the old problem is that you get to the most important part of the procedure and the patient starts feeling the operation, and then you have to do more sedation. One thing I wondered on that article, were they talking about patients' fear of waking up during surgery? And that's something that I deal with when I see a patient just before the operating room. Today they have these bispectral strips, these little white strips they put on the forehead that actually analyze the patient's brainwaves, and the anesthesiologist can tell, he has constant feedback, is the patient asleep or is the patient starting to wake up? So I have my patients asleep for most of what I do.
Yeah, that's a great point. But in Chet, I think that's what the article, at least that portion, was about, people waking up from general anesthesia. I've never seen that. Have you seen that, Chet?
No, not waking up. That's a big fear of patients, is actually waking up during surgery. And, you just try and counsel them to let them know that that's not going to happen. But some people are out there marketing things like, oh, awake surgery, you don't need anesthesia. And people just are very confused in the public because they don't know what that means. They just assume it means, oh my God, I'm waking up, I'm going to feel everything the surgeon's doing. And so it's really our part just to counsel them and let them know sort of what it is. And some procedures you want to do with a patient awake. There's certain things you do in the office where you're numbing them up and you actually want to have a discussion with the patient while you're doing the procedure. So it's about educating the patient on what's awake and what's not awake. But really, if you're using an accredited surgery center anesthesiologist that do your anesthesia, you don't have to worry about any of that. It's some of these little pop-up shops that aren't really doing things by the book that you really have to worry about.
I wanted to ask you guys briefly about, there is a thing that's marketed called awake breast augmentation, and it's generally offered by people that can't get hospital privileges to do the procedure, but they market the patient as, the biggest thing is people choose the wrong size, and so that's why you want to do it awake in like an exam room. So do you guys have any opinions about that? Because mine are pretty strongly against it.
I certainly would not do it. I would not do an awake breast augmentation. And I explain to patients they're simply going to be too uncomfortable. I've tried in the past 30 years ago to do intercostal nerve blocks to get anesthesia for a breast augmentation, and it just, in my hands at least, is impossible.
I worry about every millimeter of muscle for a submuscular aug, how I'm going to do it. Every muscle fiber gets analyzed. I just don't see how you can do that on an awake patient. I just don't think it's possible to get a really good result. I think you can get a good crappy result, but not a really good result.
Yeah,
right.
yeah.
As far as that goes about implant size, by the time we're going to the operating room with these primary breast augmentations, you have the implant size picked out. That's the way I do it, unless they have an asymmetry that you're going to have to maybe use a sizer for. And when I'm talking to the patients, I make the comment of like, yeah, I'll be sitting you up during the procedure to look at the symmetry of the breasts. And for a moment, they're like, wait, I'm waking up. I'm going to, talk to you. I was like, no, I sit you up on the table. Your arms are strapped in. That way I can look at everything and you're in the sitting position. So once again, it comes back to counseling the patients on what's expected, what's not expected.
All right, let's move to the second topic. Chet, I'm going to stick with you. So this came from one of our viewers on the Plastic Surgery channel, and it just said, there was a question basically. My doc said he's an expert at doing breast lifts, but I'm not sure how do I actually figure that out. And so what do you think? Because that's actually can be a difficult question.
Right. Well, yeah. If you go to social media, you'll find, oh my gosh, look on Instagram. Look at all these experts. They have 2 million followers. They must be the best breast surgeon out there at breast lifts. And you start to walk through their credentials or actually Google the person, you find out, oh, they're not even a plastic surgeon. They're just an entertaining character out there online who's calling themselves an expert in something. I mean, we could all be experts. This really comes down to credentials, where you did your training or your board certified plastic surgeon, and then patient outcomes. That's how we're judged. But anyone can say they're an expert, but don't look at social media, because you're going to find people out there who are just entertaining characters that are steering people the wrong way. And that's where I really wanted to lead this discussion, because people get false credentials all the time. They're just entertaining, but they're not really that expert.
I do think reviews play an important part. I think we're in this day and age. Your patient reviews are a very good source for patients, and I would guess 90% of my people I see in my practice have read reviews. And I think a patient can do their homework, check reviews. I think when they see the physician, ask to see the results of his breast lift procedures. And I always tell patients, trust your gut feelings. We all have a second sense. When you sit down with your surgeon, how do you feel when you leave the room? Are you going to be willing to call this person at 3 a.m. if you need them? I mean, a lot of this is just your interaction with your consultant.
Let me argue with these guys a little bit. I think it's difficult for the patient to figure out who's an expert. Just because you're lecturing somewhere, I've sent patients to experts across the country that were in a different city, and they had horrible results and got horribly treated by these doctors. So I'm a little bit wary these days about referring to people unless I actually have seen their work and not just on stage at a meeting. I think it requires looking at a number of before and afters of that doctor in their office, perhaps getting a referral to patients that they've operated on and are happy, talk to the staff, and just see what they're doing. I can tell you that I probably do like 5 operations, and that's it in my whole career at this stage. I mean, that's all I do. But if you ask me to do something that I'm not comfortable with, I'll tell you I probably don't do a lot of these days.
It's not an easy thing. There's a lot of ways patients can get misled, and this day and age, there's a lot of those media out there, whether it's social media or other things that are out there. It's easy to. We just had the thing last Spin Live where they had the clinic in Australia that looked like the most professional clinic ever, and they had a bunch of people. They weren't even nurses or medical professionals delivering treatment. So you can be duped, and I think just doing your homework. You got to put some homework into it.
I like what Chet said, because Chet, just because you're on Snapchat doesn't mean you're the expert in that field. I find a lot of the experts are too busy to do a lot of this stuff on social media.
Right.
They're busy in the operating room and don't have time for kind of a bunch of crap.
Right. All right, let's go to the last question. We got a great group for this one. This is about aesthetic lasers, and so what do you guys think about this? This is basically talking about the laser market. Aesthetic laser market is growing, and we're not talking about the laser and Austin Powers. We're talking about things that fix spots in the face and tighten skin. And so, Brooke, I mean, you've been one of the world's authorities on lasers for many years. So, what's your assessment of this?
Well, I think there's a big difference between what laser manufacturers promise and what in fact lasers can deliver. Lasers are really good at surface treatments, whether it's pigment, wrinkles, spots, but when you start talking about serious skin tightening, lasers, even subcutaneous lasers, still can't deliver what a tummy tuck or a facelift can deliver. So I think patients need to be wary of over-promising. A lot of physicians think they can buy a laser because the laser is going to do the procedure for them. And that's why they get into trouble. If you're going to do lasers on a person's skin, you really need to understand lasers, understand the heat production, and understand what you're doing. So I think the risk in all this publicity about lasers, a lot of people are going to buy them that don't really understand them and may not know how to use them.
Chet, what's your outlook on the laser market?
Being part of a busy spa and surgery center, we utilize lasers all the time over in the spa, and then I'll bring them over in the operating room to utilize those. And it sort of goes back to the whole philosophy of embracing technology. I mean, technology, plastic surgeons, we're the forefront. We're always welcoming technology, and technology sometimes gets ahead of some of our expertise, but being willing to welcome that and utilize it. But I agree with what Brooke said. If you think that laser is going to be the magic trick for something you're doing, it's not. If you're using it as an adjunct to your procedure, or the patient, you could do the best facelift in the world and the patient has leather skin with sunspots everywhere, they're not going to look great. You got them high, you got them tight, you got the volume back. But if their skin quality is poor and you're not optimizing their skincare, or using your lasers that you have in your spa to really optimize your outcome, you're not going to get the full effect. So being able to embrace that in the spa as well as the surgery center is definitely something that plastic surgeons should welcome.
So Jason, you just got back from one of the biggest laser meetings there is. So what'd you learn?
Nothing. No, not quite. So,
An honest man.
Yeah. So I mean, I agree with both of you guys. And just to say, Brooke was one of my laser gurus when I first started. I mean, he was like groundbreaking, one of the few groundbreaking doctors starting with this, really. But things are getting better and things are changing. And I see a time when they may replace facelifts and some of the surgeries, but not yet. Some of the newer radio frequency devices we've talked about on the past, like FaceTite and BodyTite, to me have replaced facial surgery in the right patients. Younger, not yet ready for a facelift. But my last patient for my clinic day today was a 66-year-old man who wanted FaceTite. And I said to him, no, too much skin. You need a facelift and laser resurfacing. And that was my recommendation because he thought it would have been throwing his money away with that minimally invasive technology. But, Brooke is inherently right with this. Most of them are skin changes, but with lasers. But look at cool sculpting and sculpture for fat. So we're built upon great minds like Brooke and great implementations of Brooke to get the next level and the next level and the next level.
Those are some great insights, guys. I think everybody really has enjoyed this session. If you want to see more of this, you can see it on theplasticsurgerychannel.com.